Every fall, the same commercials start playing on repeat. $0 premiums, $0 copays, $0 everything. And let's be honest, if you didn't know any better, it sounds like free Medicare. But here's the truth. In Medicare, that big zero might be the most expensive number of all. And the part nobody ever tells you, it's built right into the system. Today, we're going to be talking about the $0 premium trap, how it works, when it actually makes sense, and how to tell if it's quietly setting you up for higher costs next year. Quick question before we get rolling. Are you on a $0 premium plan right now or thinking about one for next year? I'd love to hear how it's been working for you. Drop a quick comment below and tell me about your experience. So let's start here. Why and how do $0 Medicare Advantage plans even exist? Well, they're not magic and they're not government giveaways either. They're funded by Medicare. Every time someone enrolls, Medicare pays the insurance company a flat monthly amount, usually somewhere around $1,000 per member per month, could be more. The carrier then uses that money to cover your medical care, your network costs, your customer service costs, and yes, all those little extra benefits in there. So when they advertised $0 premium, it does not mean free. It means the plan's already getting paid, just not by you directly. Matt tip, when you see $0 premium, translate it in your brain to prepaid by Medicare, because that's what's really happening behind the scenes. Now, why are there so many of them? Well, it's because they sell, and in tight financial years, like what we're seeing heading into 2026, carriers use $0 plans to look attractive while quietly cutting costs elsewhere. Now, one of the biggest shifts we're seeing heading into 2026 is fewer Medicare Advantage PPO plans and more HMOs. And a lot of people are on $0 premium PPO plans right now, and many of those are either being reduced or eliminated entirely next year. Here's why. PPOs give you more freedom, but they're also more expensive for the insurance company to manage. HMOs, on the other hand, usually have smaller provider networks, which means carriers can control costs and keep premiums low, especially in a year where federal reimbursements from the government to the Medicare insurance carriers are being squeezed. Now, I get it. When people hear HMO, they think small network and tons of restrictions. Sometimes that's true, but sometimes it's just perception. But that's exactly why it's so important to double check which doctors and hospitals are included before you switch. Matt tip, if you're switching from a PPO to an HMO, make sure your doctor's office actually accepts the plan, not just the carrier name. You got to be specific. Those small details can make a big difference come January. And that brings us to the real issue. It's not that $0 plans don't work. They do. It's just that most people don't know what they're trading for that zero. Now that we know where they come from, let's look at where the trap actually can hide. So where's the catch? If you're healthy and rarely use care, you might never notice it. But when you do need care, you start seeing what I call the pay later part of a $0 premium Medicare Advantage plan. Smaller doctor and smaller hospital networks. Higher maximum out-of-pocket limits, that MOOP again, more coinsurance instead of copays, and more prior authorizations to control what gets approved and what hoops you have to jump through. And remember, these are the same plans being hit hardest by Medicare's reimbursement cuts and star rating drops. Something has to give, and it is. Matt tip, a $0 premium doesn't mean $0 cost. It means you're betting on your future health, and the house often wins. A lot of people don't find this out until it's too late, usually right after an unexpected hospital bill lands in their mailbox. You know, one of Nikki's clients, my wife and business partner over at Brick House Agency, almost learned this lesson the hard way. They'd seen a commercial for a $0 premium plan that promised dental, vision, hearing, even a grocery card allowance. Sounded great. They were about to switch when they called Brick House just to double check. Nikki pulled up their doctor list and their pharmacy drugs, and within 5 minutes, she found the catch. 2 specialists were out of the network, and one of their prescriptions that used to have a $47 copay was moving up a tier, meaning a higher cost next year. So that free $0 plan could have cost them about $1,800 more over the next year. And the best part? They didn't have to switch. They stayed on their existing plan, kept their doctors, and avoided what would have been a very expensive free decision. Matt tip, if you ever feel like you're getting more benefits for less money, stop and ask yourself, who's paying for this? The answer is always somebody. It's usually you later. Now, to be fair, a lot of people are on $0 premium plans, and for many, they work exactly as intended. If you're on a fixed income or just prefer not to take on another monthly bill, these plans can make solid financial sense, especially if your doctors are in-network and your prescriptions are generic and affordable. There's absolutely nothing wrong with being on a $0 premium plan. The key is simply staying aware of what's changing year to year so you're not caught off guard later. Think of it as driving a reliable car. It gets you where you need to go, but you still pop the hood every once in a while, don't you? Matt tip, a $0 plan isn't a red flag. It's a reminder to stay engaged. Review it once a year, make sure it still fits, and you'll be ahead 90% of the people on Medicare. If you'd like help checking these details, visit brickhouseagency.com. My wife Nikki and her team offer free, by appointment only consultations over Zoom or phone, no pressure, and never any obligation to enroll. They'll go through your docs, your drugs, and your costs so you can see the real numbers before you make your decision. Matt tip, don't rely on a commercial or a seminar at a Denny's where everything smells like pancakes. Get your information from someone who works for you, not a call center reading a script or a whiteboard. If you're finding this helpful, hit that thumbs up. It helps more people find accurate Medicare information instead of the junk that usually clogs YouTube every fall. So how do you tell if the plan you're looking at really fits you? Here's my quick $0 plan checklist. Number 1, doctors. Confirm every specialist and hospital you care about is in network for next year by specific name. Don't just use the carrier name. Number 2, drugs. Check how each prescription is covered. Did a copay turn into a coinsurance? That's a red flag. Next red flag, big deductibles where there weren't any last year. Number 3, the MOOP, maximum out of pocket. Look up your plan's maximum out of pocket. If it's over $7,000, you're holding a pretty risky card. Number 4, extra benefits. If the freebies, dental, over-the-counter benefits, vision, they dropped or they reset, do the math on what they're really worth to you. Number 5, health outlook. If you had a big surprise last year with your health, maybe a surgery or a hospital stay or a new diagnosis, this may not be the time to chase free. Finally, let's tackle the 2 most common questions I get about these plans. So, Matt, should I never choose a $0 plan? No, of course not. If it fits your health, your doctors, and your wallet, it's fine. Just don't choose it because it's $0. Choose it because it works for you. Here's another one I get. Why are there so many of them? Well, because Medicare Advantage enrollment is massive and insurance carriers compete on headlines. $0 premium is a great headline, but headlines don't pay hospital bills. Matt tip, Medicare commercials are designed to get your attention. They're designed to get you to call them, not to explain your options in detail. That's where talking with a real person helps. So here's the bottom line. $0 premium is like free shipping. You're paying for it somewhere, you just need to know where. If you want to make sure you're comparing apples to apples, head over to brickhouseagency.com for a free consultation. No obligation to enroll, ever. I'm Matt Ferret, here to help you make smarter decisions about Medicare and retirement and to save you time and money along the way. Until next time, here's to your wealth, wisdom, and wellness. But before you go, hit like if this helped you and drop a comment below. What's the most confusing Medicare ad you've seen so far this season? Let's decode them together. And don't forget to subscribe. I've got more insider Medicare videos coming every week during Medicare open enrollment.